In one of the latest medical breakthroughs, advancements are being made in the treatment of prostate cancer. Joining us now is Dr. Neal, the U.S. Chief Medical Officer of Urology and Surgical Oncology at Genesiscare USA and Director of the Carolina Urologic Research Center at Myrtle Beach, South Carolina. What is MHSPC? Why is it making so much news lately?
Yeah, well, thanks for having me. MHSPC, another acronym in the typical medical lexicon, which can be confusing, but it stands for metastatic hormone-sensitive prostate cancer. And what that means is that the disease is spread beyond the prostate, could be in the bones, very commonly in bones. There's a unique aspect to prostate cancer that likes to go to the bone, but it could also go to the liver, lungs, soft tissue areas we call lymph nodes. So that's the metastatic part. The hormone sensitive means if we lower the male hormone level, chiefly testosterone, 90+% of initially when we do that, prostate cancer cells will go into remission, meaning they'll stop proliferating, which is a good thing.
It certainly is a good thing, doctor. Does this new treatment have FDA approval, and what does it mean for people who are living with advanced stages of prostate cancer?
Yeah, very important question. It does have FDA approval, which has been a very important, and it was a fairly rapid review by the FDA, so congratulations to them. The key trial called the ARASENS trial, which was presented at ASCO, the American Society of Clinical Oncology, GU, in 2022 in San Francisco, with a simultaneous New England Journal publication. And now, as of about a month ago, we see the FDA approving the findings from that trial, which essentially showed that a combination of an androgen receptor blocker and oral therapy known as darolutamide in combination with a chemotherapy, docetaxel, and lowering the male hormone level outperformed just the combination of a hormone suppressive therapy and the chemotherapy. So adding the third component, the oral darolutamide, now commercially known as Nubeqa, was the survival statistically significant finding, and now FDA approved.
What do patients need to know when they're speaking with their doctors about treatments, and what can you tell us about trials that are going on?
So there's a lot of important therapies that patients can avail themselves to. There have been other great trials that have occurred and other combinations that are really beneficial to patients with MHSPC. So it's really super important to speak to your healthcare provider, invariably your uro-oncologist or medical oncologist who is familiar and up to date with the latest options. Specifically for the trial that we're talking about, the ARASENS trial, I would go to the website Nubeqa, nubeqa.com.
Thank you, doctor, for your critical information today.
Pleasure. Thank you.
Go to businessfirstam.com for where to see our show on TV.